Thank you for the opportunity to present recent advances in prostate cancer care. My name is Faina Shtern. I'm a physician and founder of the AdMeTech Foundation, a nonprofit organization providing leadership for groundbreaking programs in prostate cancer at the state, national, and international levels. Our programs have been transforming patient care for all men and reducing health disparities in Black men. Dr. Sokolov, our long-term partner, will review recent advances in treatment of prostate cancer. I'll focus on emerging advances at prostate cancer screening and diagnosis. My talk will also review our new prostate cancer equity program launched recently to bring this new and exciting advances in patient care to every man in Massachusetts and eliminate health disparities. Dr. Sokolov is one of our experts providing services to prostate cancer equity program patients. Prostate cancer equity program is an integral part of the AdMeTech's ongoing statewide program in prostate cancer that created a Massachusetts model of national leadership in public awareness, medical education, and research. Our primary focus is on high-risk men, Black, Hispanic, and Latino individuals, and all men with family history of prostate cancer and increasing age, 50 and older. This program was initiated since 2009 in collaboration with multiple organizations and has three components: public awareness, community education, medical education, and research. Worcester County is an area of our concern. It has consistently had some of the highest prostate cancer mortality in Massachusetts over the last several years. For public awareness and education, we had reached well over 36,000 men since January 2020. While we are dealing with COVID pandemic, prostate cancer cannot wait. And yet many men avoid visits to their doctors out of understandable concern of contracting coronavirus. Unfortunately, delays in prostate cancer care can cause reduced quality of life and even loss of life. Clinical facilities created a safe environment for patient care, including virtual visits, telehealth, ongoing in-person care, doctor's appointments and testing, and medical procedures such as biopsies and treatment. Ongoing care is particularly important for Black, including Hispanic men, who are 2.5 times more likely to die compared to white men in our country. However, early detection saves lives and eliminates health disparities. With early detection of prostate cancer, every man is alive in 5 years. In sharp contrast, with late diagnosis, when cancer is spread to other organs, only about 28% of men remain alive during the same time. In prostate cancer, screening with blood tests called PSA is the best tool we have for prevention and early detection, critical for saving lives and reducing health disparities. If we look at the reduction of mortality per year, PSA blood test is the most successful screening tool we have had in the history of cancer. During pandemic, it is more important than ever to take charge of your prostate health. It is important to know your risk factors, such as Black heritage, family history of prostate cancer, particularly in a brother or father, and increasing age, 50 and older. You can ensure early detection. During annual visit, ask your doctor about PSA blood test and digital rectal exam. You need to talk to your doctor starting at the age of 40 if you have risk factors, or at the age of 45 if you do not have risk factors I just mentioned. Before screening, it is important to avoid exercise or sex, which may impact your testing results for 1 week. After screening, you need to ask your doctor if your test is normal or if you need to see a prostate cancer expert for further evaluation. The centerpiece of our medical education is AdMeTech's annual Global Summit on Precision Diagnosis and Treatment of Prostate Cancer. The latest 6th annual conference took place this year between September 22nd and 24th. Our summit brings together the key international experts representing every clinical expertise to review the best emerging clinical practices. This educational event showed rapid advances in screening and diagnosis of prostate cancer. In screening, our summit supports clinical guidelines for early detection recommended by the National Comprehensive Cancer Network, consisting of over 28 cancer hospitals and their leading experts. As mentioned, high-risk men, including individuals with family history or Black heritage, are recommended to start screening at the age of 40. Average risk men should start PSA screening at the age of 45. This first, or what we call baseline PSA result in younger men, has emerged as one of the most important indicators for developing lethal prostate cancer long-term, over 10 years. In diagnostics, we have seen emergence of very accurate non-invasive tools, such as blood, urine, and saliva analysis for molecular and genetic markers, and advanced imaging, including ultrasound, MRI, and molecular imaging. This non-invasive diagnostics, highlighting the importance of PSA screening, shifted past concerns about screening into a dustbin of history. For example, these diagnostics can determine which individual man has an increased risk of life-threatening, rapidly progressing prostate cancer, improve early detection critical for saving lives, reduce unnecessary procedures such as biopsies and treatment, and optimize selection of personalized care for each man, including careful observation, what we call active surveillance, minimally invasive interventions, or immediate radical treatment. High-risk individuals, including Black men, carry higher risk of both mortality, dying of prostate cancer, and unnecessary procedures. Consequently, it is critical for them to have access to precision diagnostics that determine for each individual man if he should or should not have invasive biopsy or treatment, and what options in clinical care are best for him. Unfortunately, in Massachusetts, Black men are less likely to have precision diagnostics, such as advanced imaging, MRI, or molecular imaging, or genetic testing, or undergo life-saving treatment compared to white men. Prior to undergoing invasive biopsy or treatment, it is important for each man to discuss with his doctor if any testing is available to determine if these procedures are actually needed, and if yes, what kind of options would work best for him. For example, in this slide, MRI shows prostate cancer lesions and guides biopsy needles with precision. AdMeTech has led research, development, and large-scale clinical implementation of prostate MRI since 1998. Over the last several years, leading experts use MRI before and during biopsies. I think it is fair to say that blind biopsy performed without accurate imaging is no longer a standard of care. Our summit highlighted the importance of MRI in individuals, including Black men, who have lesions in the front part of the prostate that are difficult to find by physical exam or standard blind biopsy performed without accurate imaging. In men with prostate cancer, there are two pillars of the current diagnostics, MRI and genetics. While MRI shows cancer location and local spread or stage, genetic analysis of cancer tissue reveals underlying biology and probability of progression. Emerging data indicate the importance of genetic testing for selecting the most effective treatment. With this precision diagnostics, we can now accurately determine if each individual has a slow-growing, harmless prostate cancer and needs only careful observation, active surveillance, or an aggressive prostate cancer requiring immediate, radical, life-saving treatment. More recently, molecular imaging has been shown to play an important role in staging of prostate cancer, including presence of metastatic spread and detecting return of prostate cancer after treatment. For example, PSMA molecular imaging has been approved by FDA within the last year and become available at the Dana-Farber Cancer Institute since August 2021. On the left, right here, we can see a traditional bone scale showing no metastatic spread. However, on the right, in the same patient, molecular imaging demonstrates extensive metastasis. This information is important for selecting appropriate and effective treatment. We are proud to have led research and development of molecular imaging since 2001. Based on the evidence coming from military medicine, from veteran administration, our summit concluded that equal access to high-quality care is the key factor in improving patient outcomes for all men and eliminating health disparities in Black men. It is particularly important now with so many novel diagnostic and therapeutic approaches, ensuring high-quality personalized patient care. Without equal access to these advances in patient care, we will see a widening gap in health inequalities, including survival and mortality. Consequently, AdMeTech launched the Prostate Cancer Equity Program in Massachusetts in collaboration with Mass General Brigham, UMass, and other clinical institutions with the mission to save lives and deliver high-quality care. Supporting organizations include Latino Health Insurance Program and NAACP New England Area Conference with their multiple branches located across the state. Our goal is to expedite access to leading experts who use the most advanced approaches to screening, diagnosis, and treatment available today. This program helps men to find an expert for the initial or a second opinion, in-person or virtual visits. Any Massachusetts man age 40 and older can participate. Our priority focus is on Black, Hispanic, and Latino men who are at higher risk of prostate cancer, delayed diagnosis, poor quality care, and death. We believe that in Massachusetts, with its leading hospitals and universal access to care, our prostate cancer equity program will be able to eliminate health disparities. Experts of the prostate cancer equity program can address any questions about prostate health, from assessing an individual healthy man's personal risk of cancer to informing men about all available options before and after screening, biopsy, and treatment. We are committed to supporting men during every step of their medical journey to ensure that no man is left behind or struggling alone. To achieve this goal, we created a streamlined VIP-style process of patient referral and care, reflecting how doctors involved in this program take care of our families and friends. This process consists of three components. First, AdMeTech Foundation's coordinator, Trisha Kinney, collects basic information and matches individual patients' needs with the appropriate state experts. Second, a clinical organization designates a patient navigator who works with multiple schedulers to expedite medical visit and support men within their healthcare system. And third, if an expert recommends any next steps, such as further testing or treatment, AdMeTech's coordinator and patient navigator work with patients on the appropriate follow-up. To ensure successful implementation of this program, AdMeTech has created a network of leading state experts committed to eliminating health disparities, like Dr. Mitchell Sokolov, developed an effective process for patient care and follow-up, as mentioned, recruited community coordinators in high-risk areas such as Worcester. They in turn mobilized a network of over 70 program ambassadors across the state. They are community, organizational, and church leaders, and held multiple focus groups to develop program materials. Our current goal is to identify and mobilize appropriate organizations and individuals so that men, their primary doctors, caregivers, and support groups have access to this program. Trisha Kinney, a member of the AdMeTech Foundation staff, serves as a statewide coordinator for the Prostate Cancer Equity Program. If you have any questions or need assistance, please contact Trisha by phone, 617-523-3535, or by email, coordinator@admetechfoundation.org. Thank you for your attention.